Good evening, everyone. I think I am clearly audible and visible to all of you.
Yes,
Yes,
ma'am.
ma'am.
Yeah. Good evening.
Yes, ma'am.
Yeah, okay. So, good evening to all of you. Welcome you all to the. Thank you so much for your response. Welcome you all to the FSTN Exploration Foundation Presents World Breastfeeding Week celebration. And I'm really glad to see all those who are present here in this Sunday evening. It's really very difficult for us, those who are working. I know majorly here are working as well as the students, so they get a very little time for themselves for their like for their spare time. But instead of that, you are always there with us. You are always there with FSTN. You are always there that whenever we do any celebration, whenever we do any webinar as well as any other workshops, you always being there with so much of enthusiasm, and it really means a lot, and it really gives us the boost up to do some other works, do some good work for you all, so that you all will be benefited. So really thank you so much again to all of our students, because you the FSTN is here. So we are really very glad that again you have showed up your too much love for us. Thank you so much again. So as you all know, we are all majority from the food and nutrition background as well as from the health background. So we all know that 1 to 7th August is World Breastfeeding Week, and there is something as a nutrition academy, as a nutrition institution, it's very very important that we show something, that our concern, our care for the World Breastfeeding Week. And that's why we have not come up with any physical program as well, due to this severe bad weather situation as well as many other issues. But we have arranged a webinar for you all, and it's a free webinar, so that you all can join, you all can learn something new. And it's always our motto to give you something new, something which will help you in your in your pathway. So before we start, I just want to say something. As you all know, those who are new, they don't know, but those who are with us from 2023, they know that every time when we start, we always go for a presentation about our FSTN, because here I have seen a lot of new joinees. They don't know about our no they don't know about our FSTN. So it's a very honor for me as an academic coordinator and faculty head of FSTN Exploration Foundation to share something about our FSTN. So I'm presenting my screen now. Just I will take 2 minutes from today's speaker as well as from those who have joined. 2 minutes for this, that so that I can share some of our FSTN journey with you. So a very good welcome to all of you to the FSTN Exploration Foundation. And as we know, we have met up here for the World Breastfeeding Week celebration, and we know that today's like in this year theme is about invest in breastfeeding, invest in the future. Breast milk is the nature's first vaccine. So as we all know, is the first and foremost vaccine for the newborn, as well as it's advantageous one for the mother. So I think already ma'am has prepared a lot for this, and today's speaker of course will tell you about that, so I don't may not extend for this. So about our FSTN, these are the FSTN board members for whom the FSTN is being there. And for first and foremost, I just give my heartfelt thankfulness and everything this do the person who is a brain behind FSTN, Dr. Shobhik Tiwari. Without him, it's not being possible to become where FSTN is here today. So it's a very heartfelt gratitude to Dr. Shobhik Tiwari, who is the founder and CEO of FSTN, and those are the other board members. So along with that, FSTN is an ISO certified and organization, as well as MSME approved and NITI Aayog certified organization. Now FSTN is under Skill India mission. So we have an academic collaboration with our Skill India, as well as now it's being on Skill India mission. It's FSTN, all the diploma courses is under Skill India mission. We have an academic collaboration with Skill India, and it's really an honor for us to tell it about that. Along with that, we have an academic collaboration with MGM University Aurangabad, Along with that, I just want to say this is our FSTN Academy, which is present in Belghoria, Kamarhati. I would request everyone, those who present in Kolkata, for them, please do visit our academy. It's really wonderful, and we have our internship physical mode classes going on in our academy. So this is our academy. It's present in Kamarhati, Belghoria, just opposite to Sagar Datta Hospital. And we have some FSTN specialization courses are there. So by FSTN Academy as well as FSTN Exploration Foundation. So we have our courses on certified diabetes educator. It's a very old courses of us. Along with that, the advanced diet plan making program. Along with that, the a very short term course on space nutrition, and the certificate course in GI nutrition therapy. Along with that, certified course in renal dietitian. The admission is going on now, and the certified course in critical care nutrition as well as pediatric nutrition and gynecology nutrition, a very new course which has where the faculties from the Narayana multi-speciality hospital is being associated here with us, the certified course in oncology nutrition. And along with that, we have the diploma, that is under Skill India Mission Diploma in Nutrition and Dietetics. We have more than 100 students in our diploma in nutrition and dietetics, and we are really grateful. It is under Skill India Mission directly. Along with that, we have some PG diploma in food processing and technology, and the PG diploma in sports nutrition, and 3 to 4 batches are going on this. And now coming to our FSTN Academy in collaboration with Amalgam of Benevolent Dietetic Association, we have a 3-month internship program on patient counseling. So it's the new session will start from September onwards. Another session is going on. A lot of students are there, and it's fully offline. You will get an opportunity for the doctor chamber visit as well as hospital visit, as well as you will get to know about the theoretical prospect, a very new venture we have launched about where you get the hands-on training as well as the theoretical training. It's an academic mashup or collaboration. Now if I talk about our industry visit, we have done a lot of industry visit, and many of you have gone through us about Coca-Cola, Parle, Britannia, and Mukhorochok food industry. We have done the FOSTAC training also. We have more than 150 students to be trained up as a food safety supervisor, and our 8th batch is going to be occur on 13th August. So we will provide the link very soon in your FSTN group. Again, with the collaboration of Bharat Chamber of Commerce. So again, you can get your lifetime membership in FSTN, and you will get a lot of opportunities there. So now we are coming, as it has been announced that on the occasion of the World Breastfeeding Week celebration, we will have our virtual award ceremony, which is of course organized by FSTN Exploration Foundation. So we want to congratulate Payal Roy for getting the Nutritionist Excellence Award in 2025. So a heartfelt congratulations to you, Payal. We want to congratulate Diti Priya De for your wonderful collaboration in our nutrition fraternity for the getting the Nutrition Excellence Award 2025. A heartfelt gratitude to all to you also. As well, a very heartfelt congratulations to Shakshi Mitra for getting the Research Excellence Award 2025. A very congratulations to all of you. Along with that, again a Research Excellence Award from to Dr. Monica MK. Congratulations, ma'am, for this award, getting the Research Excellence Award 2025 from FSTN Exploration Foundation. And along with that, Ms. Shilpa Shah to get the Nutritionist Excellence Award 2025. So congratulations you all. So I really want to congratulate Payal, Ms. Ditipriya, Ms. Sakshi, Ms. Dr. Monica, as well as Ms. Shilpa for getting this excellence award from our FSTN Exploration Foundation. And thank you so much who others are doing this clap reacts. We are really grateful to you for this positive response. Thank you so much for this, and thank you so much for sharing the love for our students. So I just want to say that if there is anyone present here, Shilpa, Ditipriya, Shakshi, or Payal, or Monica ma'am, so can you please just on your mic and say something about our FSTN other than we go to the next part? Is there anyone present in our meeting? Is there anyone?
Yes, ma'am.
Please.
I am Ditya De.
Yeah, please, Priya.
Thank you so much for this award, and thank you FSTN Academy for select me for this award. and this award made me feel more responsible and motivated to do my work better. And I wish Everskin Academy more success and growth in the future.
Thank you so
That's
much.
all.
Thank
Thank
you so
you
much,
so much.
Diti for your kind words. It really means a lot for us. Shilpa, do you want to say something? Yes, Shilpa, please. You can unmute your mic. Yeah.
Thank you so much, FSTN Exploration Foundation, uh, selecting me as a Nutrition Excellence Award. It is a great platform for nutritionist research. It is a very, very great platform. That's all from my side.
Thank you so much, Shilpa, for this kind words. We are really thankful to you all also that you have showered us so much of love and blessings. Thank you so much for that. So, coming to our new part, so congratulations again to all of you for your achievement. So now it's time for embracing the bond, breastfeeding with care. Now, whatever you for which you all are waiting for, a very special webinar on the Breastfeeding Week celebration by FST and Exploration Foundation. We have today with us Dr. Shweta Parida, ma'am, a very well-known face for those who do our specialization classes, diploma sports classes. For them, it's a very like you all are familiar with ma'am, and so here with us, our very own, our like very she is always with our FSTN from the very first day when it started. So we are really thankful, ma'am, again, Dr. Shweta Parida, Assistant Professor of KISDIM to be University, Odisha. We are really blessed to have ma'am always with us. And again, in this World Breastfeeding Week, we have again ma'am for her wonderful speech, and I hope you all like it. Thank you so much. Thank you so much from our FSTN Exploration Foundation. On behalf of FSTN, I extend my heartfelt gratitude to all of you. And again, I just want to say that like be with us till the last, because at the end of this session, we will share the feedback link as well as the certificate link in the message box. So you have to stay at the till the last, because we shared the feedback link as well as the certificate link in the message box here. So please do stay with us. Thank you so much, ma'am. The dais is all yours.
Thank you, Estani, for the wonderful introduction about the FSTN. It is growing very well, and I am so happy to see the active participation of the participants. The number is increasing, and there, I hope they will get some information from this session. So, without wasting time, I just start to share my slides. So, is it visible to all of you?
Mm. Yes, ma'am. You just start the
Okay.
presentation mode.
Yeah, I have already started it, the
No,
presentation.
it's not showing the presentation mode.
Is it now?
No, ma'am. You just do
Your
full.
slide is visible.
It is visible, but not in the presentation mode, ma'am.
Okay. Okay, I think there is problem. Just for a minute. So is it now in presentation mode?
Mm, no, ma'am. I am not seeing it. Any others? Tofika, Ritika, are you there? Please, can you?
Yes,
It's
ma'am, it's visible, but Shweta,
yes, it's
ma'am,
visible.
do slide share. Go to slideshow. Yes, slideshow. I'm just doing the same. Why is it not?
Ma'am, go to slideshow first.
Already I am showing the slideshow mode. But,
Yes, ma'am. Please, kindly share the entire screen. हाँ,
so is it now?
Yes, ma'am. It's
Yes,
okay.
ma'am.
Now
Yes,
it's
ma'am.
visible.
It's showing perfectly.
Okay, okay, okay. Sorry for the inconvenience. I think sometimes I just get confused. So it's been late. I think I will start directly from this uh, breastfeeding week that is going to be celebrated from the first week of August, that is 1st to 7th of August. So this time in 2025, we have the theme that prioritize breastfeeding, create sustainable support system. So it is about highlighting the long-lasting support system to the mothers and to create awareness for the breastfeeding to increase the rate of breastfeeding among the mothers all over the world, and so that it will improve the health of the mother as well as the newborn. So the objectives are generally very clear this year, that focus on particularly environment and climate change, and it will highlight the role of supporting breastfeeding to create a sustainable environment while simultaneously reducing the impact of climate change caused by the artificial feeding. So, because a lot of issues are there due to breastfeeding, as well as we have the working mothers, working hours, uh, maternal leave, and the condition of the work pressure, workload in family, as well as the in the work life. So a lot of issues are there. Climate change, because of the climate change, the heat stress is there. So a lot of issues are there. Okay, so that's why how we can collaborate those problems and create a sustainable environment for the mother for better breastfeeding practices, as well as to inform the people and to create the social behavior to motivate the person for the sustainable environment for a breastfeeding, because the mother will not hesitate in a crowded space, or some places should be there for the lactation, in particularly in station area, or maybe in the bus stand, metro city of the metro cities, as well as in airport or hospitals, uh, health centers, so that they will get a comfortable zone for the breastfeeding practices. Then third one is to anchor the breastfeeding support as a vital component to create a sustainable environment. And the fourth one is to engage the individual as well as the organization to enhance the collaboration and support for the breastfeeding. So why do we celebrate the breastfeeding week? Why there is any need to celebrate this thing? So this is celebrated first from 1992. Earlier it was also from 86. I think it was first started as a concept, but first celebrated in 1992. And for World Breastfeeding in 2019 is a global celebration, and after that it is generally continued theme wise, every year a theme wise celebration from 1st to 7th, and it is generally observed more than 120 countries. So by government policymaker, WHO, UNICEF and other organizations collaboratively do this to protect, to promote and support the breastfeeding practice. So the main aim and opposite objective um, to do the to support the mothers and to promote, establish and carry on the breastfeeding by the by knowing the benefits of these breastfeeding purpose, as well as to educate and train the healthcare practitioners particularly, so that they will support the mothers, they will nurture them how to take care of their babies and how to feed them in an effective way. Then, as well as for the government organizations to recognize the importance and the promotion and protection of breastfeeding, as it is the child's first right, and to provide proper legislation to support the breastfeeding of the mother. And the last one is to give the knowledge within the community and to enhance the bonding between a mother and a child through breastfeeding. So, how do breasts produce milk? It is, I think, it is not new to any of you. So we know that the mammary gland generally have the secrete the breast milk, and particularly the structure of alveoli, ductules, and milk ducts are there. So it is the balance of the hormones that play a major role during the milk production. So basically, the main hormone which play a major role in the milk secretion is prolactin and oxytocin. So it is a cycle. Generally, at initial phase, generally the mammary gland stores the milk, but as soon as postpartum conditions get changed, the hormonal changes are there, then only the prolactin and oxytocin play a major role to for the secretion of this milk from the mammary gland. So basically, when a baby suckles the breast, it stimulates our hypothalamus, and the hypothalamus will ultimately stimulate the pituitary gland. The pituitary gland releases oxytocin, and the oxytocin is the hormone that stimulates the mammary gland to secrete or to release the milk. So this is the way the cycle continue, and the more the baby suckle the breast properly, then we have more milk formation, as well as the breastfeeding practice will ultimately boost up the immunity of the newborn. So generally, the how in an elaborative way, I am just trying to explain it. So when oxygen is secreted, that causes a tiny muscle in the alveoli, it will start to contract and squeeze to release the milk, and the milk will flow through the duct to the areola air, and we start to feed the baby. So while baby is feeding, it stimulates the mother's brain and release more prolactin, and prolactin is the hormone that helps to make more milk for the next feed. So it is the trigger, you can say, so that triggers to produce more milk for the next feeding time after maybe 30 minutes or 1 hour, depends on the baby condition, health condition, or how sound he or she is. So the prolactin also helps to balance in our periods, and as soon as the prolactin will suppress the ovulation, but again after postpartum changes, the progesterone will get increased in its secretion, and then again ovulation period start, or the periods get continued. But generally, another in, point is there, another hormone is there, that is the frequent inhibitor lactation hormone, and it is generally responsible how much milk to be secreted, whether the breast will secrete more or low the amount of milk to be secreted, so that the uh, and it acts separately for each breast. Sometimes for left or right, it it acts separately. So basically, it is a complex process, not so simple. So one by one, I am going to discuss about the changes. So first one, for some fact, these are some of the factors. So I'm coming to the points that why the climate change is associated with breastfeeding now. Why the theme is important for this year. So as we know, the climate change is increasing day by day. We have monsoon, but you still feel sweating, as well as we have humidity related issues, stress issues are there. So how it will hamper or interfere in our breastfeeding condition? So first thing is that the heat stress can impair the lactation by affecting both endocrine system as well as the physiological state of lactating mammals. The elevated temperature can lead to dehydration also, and the dehydration will also ultimately reduce the amount of milk secretion, because ultimately the blood consistency volume will get decreased, and once the blood volume or consistency will get changed, then the milk formation and milk secretion will also get hampered. So dehydration also reduces the blood volume and flow to the mammary gland, thereby decreasing the supply of essential nutrients and precursors required for the milk synthesis. This reduction in blood volume can lead to decrease in renal function also. And also it will reduce the clearance of the metabolic waste, and ultimately it will complicate the physiological state of the infant, because the milk which we have secreted from the mothers particularly, and the milk from cow or buffalo or any other mammals, the composition is different. So that's why the mother's milk has the protein. Those proteins are generally low in lactoalbumin and good source of lactoferrin, and that's why. And whereas the good source of phosphorus and calcium as compared to other source of mama's milk, that's why it will create problem on the newborn baby, and create pressure on the kidney. That is the main problem in newborn. It will is generally happening nowadays. And the last problem is that the heat stress can also cause imbalance in prolactin and oxytocin level, and it will also interfere in cortisol, and the cortisol will be elevated, and once the cortisol will get elevated, it will again interfere in prolactin and oxytocin functions. So cortisol will inhibit the release of prolactin from the interior of pituitary, which is crucial for the synthesis of milk protein as well as the lactose as well as the lipids present in the mother's milk. And this inhibition can also reduce the milk volume. Whereas the oxytocin, the cortisol also affect the oxytocin from the posterior pituitary, and it will impair or interfering with the milk ejection reflex. So it is generally the cells during around the alveoli will fail to contract effectively, and once it will fail to contract, it will the baby will suckle, and it will not able to release the milk to the to feed the newborn. So that's why it is another, again another problem. And the third hormone which is also get affected, that is catecholamines, that is a mixture of epinephrine and norepinephrine, and uh, that further inhibit the oxytocin release, and when because of that it will difficulty in the milk ejection. So oxytocin by default it will get due to cortisol, it may get a impairment of
release or its work, as well as due to epinephrine and non-epinephrine also. So because of these hormone imbalance, it will lead to inflammation in the inflammatory cytokines like interleukins, and your interleukins can increase and potentially disrupt the normal cellular function within the mammary gland, as well as it will reduce the milk production, as well as it will produce inferior quality of milk, which is not suitable for a newborn baby. So why this breast milk is important? So we know the breast milk always contain, almost any milk contain almost 85 to 87% water. Apart from that, carbohydrate, protein, lipid, and others like vitamins, fat soluble vitamins, minerals. A lots of antibodies are there, enzymes are there, and a little bit amount of stem cells are also there. So in human protein, particularly, it is I told you already. I think the lactalbumin is very easily digested, whereas the cow's protein generally have the casein protein. Okay, and when we see the fat content, the monounsaturated means MUFA amount, and particularly the essential fatty acid, that is linoleic acid, is high in amount for that promotes the child's brain and brain development, as well as protects the individuals from the atherosclerosis in later on life. With it will build up the or stabilize the heart as well as the brain function. So that's why the mother's feed is very important. So, so, so if we see the milk constituent wise, so the first milk that is secreted just after the childbirth. So that is called as colostrum. All of us, we know that it is slightly pale yellow in color, and it is very thick and viscous, as well as it has more immunoglobulins for the which is very essential for the immunity booster for the newborn baby. Then, after the childbirth, up to 2 weeks, generally transitional milk is secreted, and after 14 days, the mature milk generally secreted. So, if we see the transitional milk, it is white in color, it is high in fat, lactose, as well as sugar. Other sugars are there, it is slightly sweeter as compared to the matured milk. And because lactose is the least sweetness index containing sugar, so that's why the other sugars are also present during this transition milk, whereas mature milk is more clear, thin, low in fat, and it is creamier in color, and the supply the crucial energy for the baby's growth. So these are some of the factors that we should avoid during the breastfeeding. So, caffeine, smoke, or maybe some medication, stress level, improper diet can hamper the milk supply. So, what are the benefits of the breastfeeding? So, for an infant, it will prevent for the newborn from any type of asthmatic problem, type 1 diabetes, obesity, any respiratory diseases, as well as gastrointestinal infections, diarrhea, and all. Whereas for the mothers, it will enrich the, the nutrient balance. It will create the attachment with the baby. It will give the immunity to the mother, as well as for the growth of the brain, because the माँ के साथ मतलब बच्चे के साथ माँ भी बड़ी होती रहती है, माँ भी सीखती रहती है, and it create a close relationship between the mother and the infant. So breastfeeding is also prevent the E. coli infection in any newborn, as well as it will increase the probiotic condition. Bifidus bacteria condition means in our large intestine, it will start to develop some lactic acid bacteria, probiotic bacteria. So that will start to appear, and the lactoferrin present in the breast milk will protect any type of enteric infections, those that may happen in the colon or rectum. So those type of infections can be prevented by lactoferrin, which is rich source in mother's milk. It also protects the any type of neonatal hypocalcemia and tetany, that is because it has a balanced calcium to phosphorus ratio that will prevent the diabetes and childhood lymphoma, any type of liver disease and bronchial asthma later in life. So the minerals and the fatty acids and the proteins, those are just uh, God's gift through the mother to our life. So other than that, it will reduce diarrhea 17 times more risk if we don't breastfeed the new infant, as well as otitis. So that is that maybe some ear infections that may appear in some newborn, and it also prevent the risk of dying. It will increase the IQ level, and if the for the better performance, academic performance, it will be beneficial. So other than that, if a mother feed properly for 2 years, then the mothers have a low risk of high blood pressure, diabetes, ovarian cancer, and breast cancer, as well as it will reduce the postpartum bleeding, as well as the postpartum depression will also get depleted, and it improves the emotional bond, obviously, as well as protects the baby from infection. And other than that, the brain maturation of the baby will get improved. So the benefit for the mother, if you see, 24% less risk in the ovarian cancer, low frequency of obesity, low frequency of diabetes, low risk of hypertension, low risk of osteoporosis. So everything can be managed somehow by the breastfeeding. So you can prevent and keep yourself healthy. So this is how generally the family should uh, get benefited, because the family income will get is stagnant, but you can reduce the expenses. So if we buy the formula uh, from the market, uh, it will cost more, but mother's feed, it is just a boon of God, and it can be an जैसे गंगा की धारा. So it is lower expensive, and it will increase the higher income source. Means it's not like higher income, it means balance the income source, and less family problems, and obviously it will help the child spacing, because the more it will start to feed, and the women generally hesitate for the next planning, family planning method. And for a particularly institution point of view, the if the mother is happy, then the satisfaction or performance at work will be better, and there will be less request for leave for the child illness, and the less frequency of extended leave, uh, especially if there is a provision of lactation room in a proper form. And uh, if it is a working mother, here she can do in a better way, she can balance the work life and motherhood in a better way. So it will help for the environmental as per societal point of view, it will helpful for the environmental sustainability, and it is safe for the natural point of view, as well as it will be uh, a good impact on the ecosystem. So the breastfeeding is often termed as natural, and we generally see that if the mother will not feed properly, what happens? Okay, so generally sometimes the impact on the body, there is sore or cracked nipples. Sometimes not enough breast milk is there, secreted from the mother, or maybe sometimes too much of breast milk, sometimes thrush, that is very painful condition for a mother, blocked milk duct, mastitis, breast abscesses. All of these means particularly the thrush and the breast abscesses are very painful for a mother to bear. To hold the milk and those are infected that couldn't be given to the newborn, and it is painful to have those heavy liquid on the breast and to bear the pain. So that's why the breastfeeding is better. The mother should not stop in any reason. So unsupportive work will also interfere in the breastfeed. If baby latching is there, then again there is the problem with breastfeeding. Then if the mother is very concerned about the nutrition point of view, weight management point of view, then there is that interferes in breastfeeding. If there is a lack of support from family or partner, that is also probably a problem in breastfeeding. As well as sometimes medication and HIV is also responsible to interfere the breastfeeding condition. So this is the condition of breastfeeding as per worldwide. So you can be clearly visible that the worldwide the percentage of infant get from below 6 months exclusively breastfed during region wise, it is showing here. So it is uh, breastfeed is common practice in South Asian countries, whereas in American countries and African countries it is quite less, almost half, or you can say more than that. So that's why we are good that we belong to South Asian country and we are having good breastfeeding rate. But still we need to get aware so that it will be like that and it will not decrease. So it is very important to know that how the breastfeeding position and what are those position, how it should be holded and how it should be performed. So first one is the cradle hold. So the mother places the baby's head near her nipple with her arm supporting the baby's body, and her other hand available to hold the breast. Second one is cradle hold, that is useful for the preterm babies, immature babies, 7 month or 8 month premature babies are there, and after an incubator condition, they when they are shifted to home, it is very difficult to handle because the organs are not so much developed. The baby is not sufficient. The body means the bones are not that much strong enough, so that's why the cross cradle hold is very beneficial for preterm babies. And next to that we have football hold type of position. So it is ideal for the mothers having the heavy breast and generally having the c-section condition. It is better in this position. You can feed your baby. The mother support the baby's hand and neck with her hand, and the body rests on the pillow alongside of her hip. And the last one, that is sideline position, that is during sleeping, how you can comfortably do the breastfeeding. So a comfortable option that doesn't put any pressure, or the mother lies side by side with her upper hand to the position of her breast. The pillow should be provided support, so that the feeding will be in a better condition without the baby's movement. So but it is not so simple as we see. So there are a lot of factors that will inhibit the breastfeeding. First is the maternal health issue. If the maternal health condition is going through a strong anxiety, any type of infection, any type of breast surgery, or any type of medication, it will affect the breastfeeding. As well as it is equally dependent on the child health issue. If the medical condition of the baby is not proper, uh, it will not properly suckle. अरे मतलब बच्चे को मन ही नहीं करता. So he or she will not get interested to feed or to suckle. Then latching difficulty, that is properly if you correctly not positioning your baby, and the milk transfer, it may, it is not suckle properly, it will try, the baby generally try to bite, and it is painful, sometimes it also happen. Then it is another problem, that low milk supply. Low milk supply is in some mothers, they may experience the low milk supply, which is very challenging. Then engorgement, that is very painful condition, that is generally a fungal infection that is generally happens in this surrounding the mammary gland area. It is generally normal a condition. The alveoli are generally very close to each other, and the mass, thickened mass, that is because of an infection particularly. Then sometimes nipple pain or nipple damage, maybe some cracks are there, maybe there is some pain is there. Then lack of support from family, from the partner, from workplace, as well as uh, the mother's ability to, because of the health, uh, body structure consciousness and all. Then other than that, cultural and social factors are there, the social norms in a public area, and unfamiliarity with the breastfeeding. Generally we prefer breastfeeding up to a newborn baby, up to 1 साल 1.5 साल का बच्चा है तो हम उसको फीड करते हुए देखना बर्दाश्त कर लेते हैं, बट मोर देन 2 years, 2.5 years, तो हम बोलते हैं कि क्या इतने बड़े बच्चे को इतना पॉपुलेटेड एरिया में ये क्या है, तो वी डोंट लाइक इट. But it is generally okay with it if one want to feed uh, the baby up to 2.5 month old, sorry, month years old, then it is okay also. So there is some of the issues that baby latching. So how to hold, how to posture them. So the first one, the baby held close to the mother with the chin touching the breast. The baby's mouth should be wide open. The lower lip is turned outward, and more of the areolar air with the nipples should be inside the mouth, like presented in this figure. So the nose should be close to the breast. The chin should, this area should also close to the breast, and the whole areolar air and with the nipples should be inside the uh, mouth of the baby, and baby should be parallel with the chest. Sometimes there is the problem that the if insufficient pumping, sorry, insufficient milk flow is there, or sometimes overflow is there, or if someone is going outside and doing her work to do the work life balance. So in that case we need to store the milk, so we need the breast pumps. So in that looks like this simple body, and it include a cup with a handle, and it will have a pump over here, and by pumping this side it will create a suction pressure, and it will take collect the milk, and it will store for the baby in the bottle. So for the pumping, breast pumping machine, when you use, so use the right breast for the pumping, it will give you better result. Then pump properly, apply warm moist heat to the breast, and it will help to release more amount of milk, and pump for each breast 10 to 15 minutes. First start with the right one, and the equipment should be properly cleaned thoroughly, and take care of yourself with proper uh, eating pattern or the nutrition condition. So other than that, I am just covering some of the maternity rights. So maternity right to health, that is the implemented in 1966. It's quite year long ago. Then a new one, that is Convention of Rights of the Child, that is implemented in 1989. It shows that the best interest of the child shall be the primary consideration. So you Apart from any type of private life, social welfare, or court of law, or administrative authorities, or legislative authorities, the child priority is the first priority of the sorry the child is the first priority for a mother. So we can provide the breastfeeding in the workplace policy. We have uh, for the for the working mothers the flexible working hour or paid breast pumping breaks, as well as safe hygienic spaces for the breastfeeding, adequate storage for the breast milk, as well as access to the nursery services for the newborn. As well as we need some more lactation rooms for to support the women to provide the breastfeed, and to maintain the different space for daily lives. They can do operate properly in that condition. So finally, I just want to conclude over here that human breast milk is therefore not only a perfectly adapted nutritional supply for the infant, but probably the most specific personalized medicine that he or she is likely to receive. Give it at a time for when the gene is expressing and being tuned for starting of life. So this is an opportunity for health imprinting that should not be missed in any way. So it is the quote from a popular paper of Lancet in 2016 said by Simon March. And I think it is the best line ever. During my PPT preparation, I have just gone through. So thank you to all the mom to providing breastfeeding. Thank you all.
Thank you so much, ma'am, for this wonderful and so much concise presentation. And just in one presentation, you have concluded everything. You have just take over everything. You just piled up everything. It's really a wonderful session, and I also as a host also, I giving my 100% concentration in this. I really, really breastfeeding is a huge topic, and to you are giving all these things, positions, everything, advantages, all the other things. You have piled up everything in just one part. Thank you so much for this wonderful session, ma'am. So I would like to ask if there are any questions, please. I have already given the feedback link, as well as two feedback link I have given. So this two feedback link is mandatory. Please do fill, and please do copy it in your clipboard, so that when we end the links, you will get that. So any question, please? Any question from anyone? If anyone want to ask any question, please. So they are just Priyanka, Ria, Moina, Oditi. They have written this thing. Any question, please? If anyone have any question.
Yes, ma'am. I wanted to ask you. There are certain mothers. Their a monthly cycle as well as their breastfeeding continues side by side. It doesn't
Yeah, yeah,
stop.
yeah.
Is it normal like that?
Yeah, yes, okay, it's okay. There is a because it is
And
about the hormone, and once it will start its balance, your normal regular periods will balance with it, and the body will cope up with all these things. So there is not to worry about it, because it may take time for balancing for certain person, but it's a natural process. It is not any harmful for in any way. Um,
what food products would increase the milk supply, madam?
Milk supply, I think there is no um, supply के लिए uh, there is no certain food actually. I don't think that there is any. It is about all the hormones. So if the hormones will play properly, it will be a balanced way. And for the, because a lot of mother are healthy, but still there is low secretion of milk, and
Yes,
it
yes.
cannot be increased because of any type of medication or any type of food source cannot boost up. Only the stress level, the happiness, manage, so balancing those bonding with the newborn, and so giving yourself proper time, meditating, mental wellness will helpful. Otherwise there is no room to increase the increase the breastfeeding condition, or to increase the breast milk secretion, or to boost the milk secretion. Yeah.
And doctor, things like they say that more the baby latches, the
Yes.
milk supply will increase. Is this
Yes, yes,
correct or no?
yes, exactly. It is very important. The more there is a balance, it will sucker, and it will some oxytocin get triggered. Oxytocin again will start to compress the muscle around the alveoli, and it will whatever it is storing inside, it will just started to flow. So बस वो गंगा में उतना पानी होना चाहिए, वरना वरना फिर कहाँ से सूखा ही पड़ा रहेगा. So if
Okay. Okay.
the milk supply is enough, if the oxytocin and prolactin will play properly, and it will act on the milk supply properly, then only there will be no issue. And I think in some cases there is there is the particularly anemic condition, maybe it interfere with the milk secretion also.
Okay. Okay. Very informative point, ma'am. Thank you so much.
Okay.
Ma'am, other questions are there. I think you are able to see that. Uh,
Uh,
Priyanka has asked, how can one mother stop the habit of the baby feeding breast milk?
baby, how the mother stop. Okay, so baby breastfeeding practices, some of the traditional ways are there just to stop, some put some bittering compound, or yeah, you just stay away for some days, keep a distance for at least 8 to 10 days. तो वो पैटर्न बच्चे का जो होता है वो माँ को ढूंढेगी, बट वो चीज, and particularly the putting some bittering compounds, or sometimes through proper hesitation, or to keep to reduce the volume a number of times day by day, that can also change the feeding pattern, or ultimately it will be stopped.
Ma'am, another question is there. How far lactagogue will help during lactation?
Lactogause will help during lactation. Lactogause, actually it will helpful, obviously, but the more times we pump the gauze का pressure ज़्यादा नहीं होना चाहिए. So the gauze pressure should be parallel to the suckle pressure of a baby. Otherwise, the